Obesity is one of the most pressing health challenges of our time, affecting millions of people worldwide. It is more than just excess weight. Rather, it is a medical condition that can lead to life-threatening diseases like heart disease, stroke, diabetes, and even certain type of cancer. Unfortunately, some people think that obesity is a simple case of overeating without recognizing the complex factors that can actually contribute to it. On this edition of Nonye's Healthy Living Show, we get to explore the causes of obesity, its complications, and how to, of course, prevent and manage the disease. So, whether you or someone you love is facing weight issues, it's very important that we explore the causes of obesity for us to get insight into how we can maintain a healthy weight for our overall well-being. This is Nonye's Healthy Living Show, and today on the program, we get to talk about obesity and its complications. Joining the conversation today on the program, I have Dr. Justina N. Okoli. She is a registered nutritionist dietitian, registered nurse educator, and acting head of the Department of Human Nutrition and Dietetics, Nnamdi Azikiwe University, Nnewi campus. Good evening, Ma. Welcome to the program.
Good evening. Thank you very much.
All right, it's a pleasure to have you on the Yes Healthy Living Show.
I'm also thrilled to be here.
Okay. All right, just like I stated earlier, we want to talk about obesity and its complications. When people talk about obesity, people think it's just a case of gaining excess weight and overeating. Well, is that what it is? Or is there more to obesity than meets the eye? Well, a registered nutritionist and dietitian is here to lay all these facts to bear. So I'd like to begin the conversation this way. We'd like to understand what obesity is and if it's actually different from overeating or being overweight.
Thank you very much for that question. Obesity is a condition. It's actually a nutrition-related disease condition when somebody has excess fats in his or her system, resulting to health risks. So it can also be said much weight, excess weight, adipose, chronic weight-related disease. Think of it in any way. It is excess of body weight as a result of presence of fat in the body.
Okay, so what are the causes?
There are many causes. The causes ranges from genetics. Somebody can be born with that because he or she inherited that from parents. It could also be as a result of poor feeding habits. This can result from ignorance. People will say they are eating. But what are they eating? Becomes a problem. So poor feeding habits could be as a result of ignorance, could also be as a result of bad culture. Somebody was born into the culture of overeating. The person is not eating what we have called mixed diets. In mixed diets, you have combination of food groups that make up what you're supposed to eat. It can also be as a result of culture. Like in some culture, when a woman puts to bed, that is puerperum. When the woman is nursing her baby. In African setup, we used to keep the woman and we pour in a lot of food. We cook so that she will replenish what she lost. But many times people overcook and people overeat. There are also cases of cultural heritage of preparing young girls for marriage, like in cross-river areas, where the baby will be put in a room. She will not be participating in any active exercise, and she will be fed, all to bring the best out of her. At times, it causes obesity. There could be drug-related obesity. where people take drugs like contraceptive pills. Those drugs are made up of estrogen and progesterone, that is hormones, that helps in retaining water in the body. And at the end of the day, the person may now become overweight or obese. There are also cases of inactivity, because what happens in obesity is the energy intake is more than energy expenditure. In that situation, the energy being retained in the body overwhelms the energy in the energy being expended. In that case, the person may become obese. There are other cases of people not really engaging in exercise. In that situation, the energy intake becomes higher than energy expenditure. There are other many cases. However, the most important thing to note is that the person is not expending energy more than the person is taking in. Some people under poor eating culture, they embark on high energy intake from fatty foods, from frying their foods, and not eating enough vegetables. In that situation, fat becomes the problem and obesity results.
Okay, you know, I see a lot of people when they're going through something or when they're having difficulties, or for instance, when they're going through emotional turmoil, they resort to eating. So, what I'd like to understand is, does overeating in any way contribute to people becoming obese?
Yes, in that situation, people find solace in eating. They think that their problem could be solved by eating.
So they turn to eating for comfort.
Yes, they are eating to make up. Something is missing. So they are really not getting it. They are eating to make up. And in that situation, they become obese.
So it's possible, actually.
Yeah, it's possible.
Okay.
It's possible. And at times people may be, that is, using food as a succor. You know, instead of reaching out to other people when they have problems, discussing their problems, and they now resort to eating, and it doesn't help.
Okay, judging from what you said earlier, you said when you were talking about the causes of obesity, you said something about the fact that obesity could also be as a result of lifestyle factors or genetics. But over here, most people are usually under the misconception that overeating always has to do with that obesity always has to do with overeating. Why do you think we always have that impression? Meanwhile, there are other causes of obesity, but why is it that we usually focus on the overeating aspects?
Yes, you know, some people are not well educated on some of these things. So because they always see that person eating, so they can really associate it with overeating. But there could be more to that. There could be more to that. But even culturally, you know, there is this adage that people say, come on, God, don't eat it.
Yeah.
They may not like to really
Cut down on what
discipline
they eat
themselves. It needs a lot of discipline. So that is it. So some people can actually associate that because they're always eating. People may say, yes, they're always eating. They're always eating. That is why they are big like that.
Forgetting that some people actually eat a lot and they don't add weight.
Yeah, some people are like that because there is what we call metabolic rate. Some people have high metabolic rates, while some people have lower metabolic rate. So in that situation, that person may have the ability to burn the calories easily, more than that other person that has, you know, lower metabolic rates.
All right, so let's talk about BMI, the body mass index, how it's
Yes.
calculated, and at what point, and how people can know if their BMI has gotten to the obesity level. How does that work?
BMI, body mass index, is the measure we use to calculate,
When
to
somebody
now
else,
classify.
that this person
Yes, is obese or has a normal weight or moderately obese. And it has some ranges.
Okay.
Yes. So it is when you get somebody's weight in kilogram and you divide it with the person's height in meter squared. So from that, you now know the range. Normal range is from, from 18.5 centimeter to 24. Anything above 24 is overweight. And from then, you can get moderate obesity and real obesity. So what we advocate is for somebody to have normal BMI that ranges from 18.5 kilogram meter square to 24.9. Anything above that is dangerous.
Okay. All right. So with all this, one would say that you don't necessarily need to see a very big person. That somebody can be actually lean and be obese.
Yes.
Is that what you're saying?
Yes, because somebody may not actually know
that they
because it does not at times depend on the size.
Big.
Yes.
Okay.
So what matters is that measure. Once it is taken and it is within normal range, you can now say. And once it is taken, it is above. You now say that this person, and the person begins to take action because there are a lot of dangers that may come that person's way if care is not taken.
Okay. Yeah, there are some people that, for instance, when they were growing up or when they were born, they've always been, they've never been on the lean or the slim side.
Yes.
They've always had some weights, and those people will tell you that they have tried exercise, they have tried portion control, they have tried diets, and then nothing seems to work. For some reason, they still keep getting bigger and bigger. And the thing about technology is that technology has come to make people's life easier, in as much as sometimes we tend to overuse it. Now, gastric bypass is something that people usually go for to, help regulate their weight. What I want to understand is it a very effective method with regards to weight control?
Well, in that case, I'm not a surgeon, but I would say that it may work for some people, whereas in some people it may not work. Because for any surgical intervention, there are a lot of challenges, complications. So because I'm not a surgeon, I may not like to discuss that. So it's safer and cheaper to manage obesity with nutrition because they are easily affordable and available.
What if nutrition doesn't work?
Nutrition works because what happens is that people are never committed. They say, is it not food? Is it not food? They will not be committed to do the right thing. In the first place, they may never see a nutritionist or a dietitian who will now take the person's history. It is very, very important. Taking the diet history of that person and taking measurements to have what we call baseline information. Because when that is taken, you can now begin to know how best to manage this person. And it means a lot of encouragement. Somebody who is used to eating and you now begin to modify his or her diet, it's not easy. It's not always easy. But that person needs a lot of talking with, and also encouraging that person.
Sorry to interject. You said something about diet history. What do you mean?
Yes, in diet history, you need to take how that person eats. It's very important.
Okay.
And there are many ways. There is what we call 24-hour recall, where the person is allowed to remember what the person has eaten in the past 24 hours. There is also what we call weighing, food weighing, in order to have a concept of what the person is, the measurement. You talked about portion size and portion control because it is very, very important. But where you have not taken that person's history, maybe the person is used to taking a lot of what we call empty calories. Yeah, jargon, taking buns, taking Coke, and you say, I've eaten.
You said the empty calories. So there are calories that are actually full calories. Like
those foods give only one food nutrient, and it's not good. because we have about 6 nutrients that must be eaten in order to have what we call adequate diet. And it includes food will give you energy. And that comes from our foods, local food sources. I'm not talking about Oyibo food. Like yam, like our cocoyam, like our cassava, potatoes.
But what is, I didn't know, calories, carbs?
They are calories because we need it to give us energy.
Okay.
Energy. It has a part to play.
Yeah.
Then you have the food that will give you protein, proteinous foods. Foods like crayfish, food like plant foods, beans, foods like egg, foods like meat, if you want to go higher, egg, all those things, milk, they are all available. They are all available. Then you talk of food that will give you fats and oils. We are making reference to our granules, our red palm oil, our groundnut oil or any vegetable oil, and others. Then we have fruits and vegetables. They are very, very important because these foods will give you vitamins. And you know there are a lot of vitamins, and all of them are important. We have fat-soluble vitamins, we have water-soluble vitamins. The ones that are called water-soluble dissolve easily in water, whereas the other one dissolve easily in fats. So in that nature, they can give us opportunity of maintaining our body. They are for protection, maintenance, even though they are required in small amount. That is what we call micronutrients. But they are very, very important because it's only when they are present in the body that they can now help the energy, that is the macro nutrients called fats, protein, and the carbohydrates to now work effectively. Then water. Water is very, very important, and it needs to be taken very well because it aids digestion. Then protein will help us to grow and repair our worn tissues. Carbohydrates and fats will give us energy. All of them needs to be taken in the right proportion. And you can only get them when you are eating what we call mixed diet. And how do you know practically what mixed diet is all about? That is what we call dietary diversity score. When you look at the table of, that is the plate of food that is served before you, you should be able to count different colors that are contained in that food. And if you're able to count up to 4 or 5, that means the dietary diversity score of that food is rich. It translates practically that you are eating on what we call mixed diet or adequate diet. And that is what we need for healthy living. And that takes us to what a wife of Governor Dr. Nonye Soludo is doing. These things are available and can be, harnessed from our environment. They are not difficult to really get. And we continue to eat them to feel better and be happy. When you have eaten what your body really needs, you become happy. You sweat. And next thing you relax. That's nature for you. And that is what natural food does.
Okay, but the confusion with all this nutrition thing is when you come online, some people will tell you that you should avoid carbs because carbs has a way of adding calories to you and makes you fat. You should rather focus on greens and vegetables and fruits and all that and avoid carbohydrates. So where do we draw the line?
No. From nutrition point of view, from even health point of view, you should not avoid. Carbohydrates you are taking supposed to contribute about 50 to 60% of your energy. It is very, very important.
Isn't that a lot of carbs?
Nobody gets overweight or obese with adequate diet. So it is very, very important the person sees nutritionist or being referred to a nutritionist and a dietitian. They will take the diet history, take measurements. So you cannot treat somebody or you cannot manage somebody in isolation. So the person needs to come or consult the dietitian or the nutritionist. When that is done, the person will take time to take these histories because they are important, because there is what we call dietary pattern. The dietary pattern of individuals, dietary pattern of a community. It helps to really show us or confirm the type of nutrition problem they have. And with
Is that what the dietary pattern is all about?
yes, dietary pattern, how you consume your food, how regular, how you even,
Does it
get
also
those
translate to the type
yes,
of food?
preservation of food and all that, food hygiene. Yes,
And
that
the
is
type
what,
of food they eat?
yes,
Okay.
it's very, very important. And no other person does it very well, apart from nutritionists and dietitians. That is what they studied. And of course, nutritionist is a science of its own that deals with the study of food nutrients, how they operate inside the body in order to make us to be healthy. Then dietetics is also a science of food nutrients in disease and in health. Of course, it is kind of a linking between nutritionists and the clinical, that is in the hospital setting, community health center and all that. Both of them are very, very important. For us to be healthy, you need to consult a dietitian, a nutritionist from time to time. They will put you through. Otherwise, all these things they are saying cannot really be found scientifically. Nobody does that. You must need carbohydrates. So in order to really manage, you now know how to modify these nutrients when there is disease condition.
Okay.
Thank you.
So yeah, there is something called intermittent fasting that a lot of people are adopting right now for weight loss. Is it very effective in managing obese patients? Is this something that could work?
Well, in nutrition and dietetics, we don't even advocate fasting. But some people does that
You guys
because of
don't?
religious, yes.
No,
Because
this one is not
supposed to-
religion. This one is
it's supposed-
just fasting, just purging. They call it intermittent fasting.
It's not advocated in nutrition. That's what I'm saying. Because you're supposed to have at least 3 square meals. Then you have in between meal, that is snacks. Because you have what you're supposed to eat in the morning. Like in African setting, we have 3 square meals. You have your breakfast, you have your lunch, then you have your dinner. It is important that every normal person eats in this regard. Because if you do not eat, you are creating problems for yourself. Because adequate eating helps you to really stay healthy, to remain active, to be brilliant, to learn. Because you know what happens to children when they are hungry? They don't listen in the class. They'll be making noise. They'll be fighting. It's because they have not really eaten well. So good eating is very, very important. And you must not omit meal. You must not. But when there are disease conditions and their meal needs to be modified, that is where the dietitian comes in. Because she or he knows how to modify your meal in accordance with the doctor's instruction to meet up with your energy and other nutrient needs. It is important. You do not advise anybody to omit meals, unless the person is, that is when it is medically indicated. Maybe the person is going for surgery, something like that, and the preparation includes meal per aura. That is not eating anything by mouth. So that one is a different scenario.
Okay.
Like now, it is Lenten season. Some people fast. That one is allowed because of his or her religious
So are you saying it's
inclinations.
only a religious ground that people could actually fast?
Yes, and even at that, some people's condition may not allow them to fast.
But people that
and
have
it is
ulcer?
not indicated. Yes, pregnant mothers, lactating mothers, children aged 0 to 5 years.
Ulcer patients.
Ulcer patients, you see. So before you should fast, it is important you see your doctor, your nutritionist, and your dietitian, so that they will now help to really assist you better, so that you don't go into having problems while you are, running away from food. Food should be enjoyed. And once it is adequate diet, it will go into the body and do the work that it's supposed to do.
All right, this is still on Yes Healthy Living Show, right here on Annenberg Force, and we've been talking about obesity and its complications. And I will be speaking with Dr. Justina Okoli, registered nutritionist, dietitian, and acting head of department as well of the Department of Human Nutrition and Dietetics, now the Azagre University, Mary campus. She has been dissecting the topic and providing insights into the issue of obesity and also its attendant consequences. Right now, we would like to look at obesity as a medical condition and the health implications. Remember, during the introduction, I said that a lot of people are always under the misconception that every time you talk about obesity, you're always talking about excess weight or just overeating. However, that it goes beyond that. It's a medical condition that could actually lead to more life-threatening diseases. So I would like to talk about the correlation between obesity and heart disease and stroke.
Yes, thank you very much. In obesity, it has high chance of leading to heart diseases, chronic heart diseases. Because we have said obesity is excess fat in the body. So when there is excess fat, it has no restriction, actually, of where it is laid. And many times it is laid within the, inside the arteries, inside the veins. And when that is allowed to accumulate, it slows down blood circulation to every part of the body, including the heart. And you know the heart is one of the most important organs in the body. So it leads to what we call atherosclerosis. Atherosclerosis is deposition of fatty substances in the lumen of the arteries. And when that is allowed to continue over a long period, it can lead to hypertension and many other heart diseases because it does not allow blood to flow to vital centers in the body. The heart itself may also be lacking in blood, so also with other body organs. And the hypertension, they said, is a silent killer. It is better prevented than managed. So, obesity is capable of leading to death following hypertension, if not managed. So my advice is that it should be avoided. Obesity should be avoided. And you know, some people genetically they are disposed. Maybe their parents had hypertension and they also have obesity. So when two elements like that jam together, it may cause the emergency death, and it's not good. So obesity can cause a lot of heart diseases.
Okay. All right. So what about type 2 diabetes? What's the correlation?
It is also related because we have said that obesity is excess fat, excess weight. And what happens? Type 2 diabetes is adult onset diabetes because of the increase in the size of the body. The insulin, ability of the insulin to reach these excess body fats, excess body mass will be, limiting. In that situation, the glucose metabolism, that is the insulin, is for kind of metabolizing, working on the sugar found in the food. So the insulin will no longer be enough. And that is how adult onset or type 2 diabetes results. So obesity is a co-founder in that situation, so it should be avoided.
All right, so why do obese individuals have breathing problems like sleep apnea?
Yes, we have said When there is accumulation of fat, like in the heart, like in the respiratory lungs, it will not allow those organs to effectively contract and do its functions very well. In that situation, it may affect sleeping, it may affect, that is, it will affect all the organs that are necessary. And in that situation, the person may be snoring, and suddenly the person may wake up and start having complaining problems. Apnea, it disturbs a lot of people. So it is not good to be obese, actually.
Okay, so how does it affect the joints and the bones? Because I hear a lot of people saying, your legs, some people complaining about their legs, saying the weight is pressing on their legs and all sort of things.
Yes,
how does that work?
Because of excessive weight. The joint carries the weight of the body. But when these innocent joints are now challenged, the tendency for the joints is for the joint to give away. Because of the excess weight, the joint is no longer able to carry this excess weight. And it's, it leads to a lot of pains, The person complains, and that's why some of them start having bowel. And apart from that, some of these people that their own obesity was caused by poor feeding habits. Maybe the person may be consuming a lot of high energy foods. The person is not eating on adequate diet. So it continues to add weight, and that weight translates to the joint, and the joint will now be facing problems. So it is a matter of don't be obese in order not to have joint problems. And once joint problems sets in, it's difficult to really manage, because you need to lose weight before you can now actually get yourself back. And it has to be early enough. Otherwise, there will be a lot of problems.
All right. So I was having a discussion with somebody earlier in the week with regards to this topic that we're treating right now. Okay. And the person lost someone. And so I was asking her, like I saw a picture that she put up on her WhatsApp status about the burial of the lady. So I was not asking how old that lady was, because the lady was actually very big. Very big. Like, I don't think this chair might be enough to... Yeah, that's it. So she might occupy here and she might not feel very comfortable. You understand? So I was not asking how old the lady is dead. So it was her obituary poster that she put up on her social media page. So I wanted to find out, I was asking her, who is that lady and all. So she was saying it's a family friend and all that. She now went on to give some kind of history about the lady, and that she just recently adopted last year, that she didn't have a child and all that. So that brings me to what I want to ask you next. Is there a correlation between infertility and obesity?
Yes.
Because she was implying that it was because of the lady's weight that she couldn't conceive.
Yes, though there are many causes of infertility,
but want to know,
there is a relationship between obesity and infertility, because we are talking about excess fat. That excess fat can find itself to any part of the body, including the ovaries. The ovaries function includes production of eggs, from immature eggs to mature eggs, and releasing it before conception can now take place. So fertilization can now take place. So in cases where there is obesity, there is a lot of fats. So that presence of fat can make the ovaries not to function, to produce eggs that will be fertilized. So where eggs are not produced, there will be nothing to fertilize. So there will be no human being. So in that situation, it can result in infertility. The same thing applies when there is excess fat. It can also close up the fallopian tubes. It can enter anywhere and cause obstructions. And when there is obstructions, the fertilized eggs may not even pass to be embedded. So it is a problem. So a lot of obese people have problems with infertility due to excess of these fat cells circulating in their body. So it can be a factor in infertility.
All right. Okay, let's talk about how does obesity affect people's psyche in terms of their mental health and self-esteem.
Yeah, it's a lot of problem for them because emotionally, socially, they feel unfit.
And inadequate?
Yes, many of them even because of their size, they don't like appearing in social gathering. It's a big problem because they will think of how people will be looking at them. Many times it may make them to miss their steps. When they eventually come into a crowd or social gathering, they may not find adequate seats. These plastic chairs we use these days, you see them mounting.
Doubling it.
Yes. And when they think of that, at times, it makes them to feel shy and they may not like appearing at all. So it's a problem, it's emotional, and at times when people are mentally sick, it may lead them, maybe I forgot to talk about that one when I was talking about the causes.
Okay.
May lead them to excessive eating, yes. Then when somebody is overweight or obese, it can affect them psychologically, emotionally, and otherwise. And you see them at times, they play tantrums. They say, is it because of my size? God, why? God, why? It makes them really uncomfortable. And many times, they don't like to appear in social gatherings. And you need social interaction. So it is not good for them.
Okay. All right, still looking at obesity and its complications. We've been able to understand what obesity entails, all thanks to the registered dietitian nutritionist with us here on the show. We've also been able to look at the causes and, of course, the health implications, moving beyond the fact that obesity is not just overeating, it's not just excess weight, but obesity has more to do with a medical condition, and there are a host of factors that can actually contribute to obesity, like genetics, lifestyle factors, environment, and even psychological influences, just like we talked about right now. So we've managed to look at all these aspects of obesity. Now we would like to know, is there a cure? Is there a cure? How do we manage it? How do we prevent it?
Thank you very much for that question. There is this common adage that says prevention is better than cure. If you can prevent, it's better you prevent. And how do you prevent? We have 4 approaches. Their lifestyle changes. It's very, very important. It's very, very important. Some people may be genetically disposed to that. If you know already that, you come out to the world as you are growing, you see that your parents are obese or overweight, you start early to work on yourselves. It's very, very important. By adopting adequate food, period. Then, including a lot of vegetables and fruits in your food. Do not fry your food. Eat your food naturally. Take water. That's about nutrition. And avoid empty calories, as I've said. Then be very, very careful on what you eat. Don't embark on drug abuse, because we have said that drugs also cause obesity. Then you embark on exercise. Always keep fit. And thanks to our First Lady, what she's doing. She's doing very well on that. And that have also helped a lot of women to be keeping fit. Of course, we forgot to say that obesity can affect both men and women and children. But it's more in women.
Why is that?
Probably because of their physiological
Makeup.
Changes in their life, like becoming pregnant, becoming a lactating mother and all that. And they are not trying to, do exercise to go back before another pregnancy. So then you have to eat on adequate diet. It's very, very important. We keep on stressing it. Maybe if time permits, I will still give us some foods, Then drugs is another approach, but it is left for the doctors. They know how to use it. Then there could also be surgical intervention. but it is left for the medical practitioners. I'm not going into that. Exercise is very, very important. Then the management. Once it has happened, it has happened. And you cannot leave the person. You must help the person. You must take, from nutrition point of view, you must take adequate history of that person. To know how obesity came about in the first place is very, very important. First line of management. Then you go into knowing in details how the person eats, what food the person is usually eating more often, because it's very, very important. The quantity of the food the person consumes, the time interval, the time of feeding, because some people like late night feeding, you see. That's why the diet history must be in details. Then you take time to do the measurements. You do the weight, you do the height, you do all the circumferences in order to get your measurements. There could also be other biochemical tests that will be required. That should be ordered by the doctor, you know. Then you take time and do what we call nutrition care process. After the assessment, you now plan the person's care based on the measurement, body dimensions of this person, in order to know whether the person is overweight, obese, or just normal. But in this situation, we are not talking about normal weight. The person is already obese. Then for your nutritional care, you have to also encourage the person. Some people are already psychologically finished because they have this condition. You have to give him or her your words and talk to him or her in a very polite way, in a language the person will understand. You address the person correctly. If say chief, you address the person correctly. Chief this, chief that. It's very, very important. So you bring out your working tools. In dietetics, we have what we call working tools. The measurements we use to interpret the food portions. It's unfortunate I didn't come with any. It's because of the circumstances surrounding my coming. So when these are late, you begin to talk to the person one by one. It is not in a hurry. It is not in a hurry. You don't do this type of work in a hurry and sell it. You bring out the food groups. You show the person the portion based on the history and the weight of the body you have already measured. And by the time you go around talking to the person, demonstrating to the person will feel very relaxed and know that you are doing this work for him or her, and that will now help him to adhere to the instructions you are giving. It is very, very important. Then you begin to now talk to the person. If the person was used to frying his or food, you give the person other methods of cooking that will help the person to reduce the quantity of fat that goes into his or her body. There are many alternatives to now expose the patient to. And you also advise him or her on the importance of keeping to these instructions or these pieces of advice or instructions, because they are very, very important. Then for the diet of this person, the calorie intake needs to be worked on. You have to determine the caloric needs of that person based on his height and his weight, plus his age and physiological state. Physiological state, I mean here, if the person is a pregnant mother, you will not manage her like any other patient who is obese. If the person is a barrel pusher, you will not manage him or her as, So there are peculiarities in the management, but above all, there is need to modify the caloric intake to suit the management you are going to take the person on. It is very, very important. The person can eat and take water as the person is taking. Why? It will now help to occupy some spaces in the stomach and will not allow the person
To eat more.
The person can also increase his fiber intake. By so doing, it helps to mop up some of this excessive fats from the system and also make the person to have a feeling of fullness that he or she has eaten. The person can also take water before eating. These are the strategies we use in order to reduce the caloric intake of this person. Exercise is very, very important. The person can aggressively or actively be involved this time. Maybe he drives to the office if he's a public servant or civil servant. If the office is not far, the person can trek to the office. You take it easy, start early, work smart, If market is closer, trek to the market, don't drive to the market. If church is closer, no, these are small, small things that matter. And let it be a gradual something. So that, because it's not easy for an obese to stop eating if he or she has been used to eating large quantity. In some cultures, people eat voraciously.
Yes.
They eat voraciously. It is their culture. So in that situation, with the portion size, which should be gradual, the person comes to terms with the management of his or her condition using nutritional approach.
Okay. All right. So is there a correlation that sleep has to obesity? Does sleep help in weight management? Sleeping
is good. It's one of the ways to keep healthy. But some people, if they have not eaten well, they may not sleep well. You see the importance of food in sleeping. Some people sleep better when they are hungry. So it depends. But all work and no play makes Jack a dull boy. So there is need for moderation. You should not sleep all day, otherwise you die of hunger. So it's important. So you program yourself.
You add weight.
There is 8 hours. That is normal sleeping distance is 8 hours. But when you sleep and you are predisposed to developing obesity and you are not keeping active, it can add to your condition. It can actually add to your condition when you oversleep and you don't take time to actively be involved after sleeping. And on top of that, you are not eating adequate food. You are overeating. So that is that.
All right. Okay. We are rounding up. But before we go, you said if time permits, you're going to say something about, to give a diet plan or something, or talk about food that is very good for people to consume. Like, can you just do that briefly?
Okay. Thank you very much. There are what we call empty calories. Okay. And those foods are not good at all for anybody.
Okay,
talk less of obese. Okay. Empty calories include like all these bottled drinks. Okay. I won't mention any
No, of course, don't mention.
Yeah, yeah. So it's better to take water. Safe water is good. Okay. After eating a nice meal, you take water, wash it down. If you must take drinks outside water, you can easily prepare your traditional or natural drinks. You see our zobo without artificial addition. It's very nice. You see our kunu drink. You see our pap. You see our palm wine. They're all good. You can actually consume them. Then you mix your food with a lot of vegetables and fruits. You avoid frying your foods. Take other methods of preparing food rather than frying. Ferment your food.
Ferment?
Fermentation helps, yes. Like all these fermented products are nice because there is tendency for reduction in the processes. Reduction.
I thought it raises the acidic level.
No. It's very good because when you ferment your food, like all these are okpaka, ogiri, they are all fermented foods. Gare. Proper fermentation is important in nutrition, yes. Then you avoid food that will give you high calorie.
Like?
Granules is a high caloric food, but you need to combine it to have a wholesome meal. When you have eaten a lot of granules, it tries to fill your stomach, you know. And that alone is not adequate. You need to combine your food very well. When you have eaten in a party and you know you're obese, when you come home, you're supposed to take water and sleep. There's no point going to eat again. It's moderation. It needs discipline, you know, and you need to be monitoring your weight. It's very, very important because if you are saying that you are doing it, you are not monitoring it, nobody is sure because it's not evidence-based. Because remember, you took it to have a baseline. So you need to be monitoring to now know
where you are.
Yeah, it's very, very important. Then you encourage yourself on all these local food sources more than eating synthetically prepared food. Fine processed food, you know. You can prefer taking gari than taking these ones that has been so much processed that it doesn't, everything will be absorbed. No, you take food that you have, you know, some that will not be absorbed. Like gari has chaff, fiber. It is better than taking something like
Semovita?
Semovita. Semo. Let me not put Vita because it's a brand name. You know, we are very, very careful when we
that's why, yes.
so that we are not discrediting anybody.
Like Semo.
And we are not promoting anybody. We are promoting our local foods, which can be gotten from around in our farms. And that is why I'm very happy with our First Lady in all her efforts to provide food in our gardens. It is very, very important. So it is very, very okay for the obese to really get back his or her weight with nutrition care in addition to others, because he or she must show commitment before it can work. And it does not just end in one day. It takes a whole lot of time.
Consistent
and
efforts.
That is why some of them do not actually, you know, stay on the advice. And that is the problem. They will say it's not working. They don't want to take carbon. They want to take this one. No, it does not work that way. They must show commitment. And that is why it is important they are seen by nutritionists and dietitians who will put them through, you know, stress-free. Thank you.
All right, thank you, Dr. Justin Okoli, for that wonderful insights on obesity and its complications. I would like everyone to know that obesity is beyond a cosmetic issue. It's actually a very serious health condition that, if not properly managed, could lead to life-threatening diseases. However, the good thing from the conversation today that it's actually preventable and it can be managed with the right approach. So all you need to do is eat healthy, regular exercise and stress management, and also medical supports when necessary, especially when it has to do with psychology, mental health. If you're eating because you're facing emotional turmoil and all that, maybe it's time for you to talk to a healthcare provider. But the thing you need to know is, it's not a death sentence, right?
It's not. It's not
a death sentence.
It has a lot of complications.
It has a lot of complications.
Even surgical, you know, complications in surgery, you know, body appearance trying,
Stomach
and
all
the
that.
get how
But
they
with
work.
proper management, you can be better, right?
Yeah.
And it requires discipline and commitment. Am I right?
Exactly.
Okay, so and this is what our First Lady is doing. That is why she keeps promoting healthy living, because she realizes that healthy living is important for you to live a wholesome and fulfilled life. That is why she's committed to it, and that is why we always do this here. Bring us back to talk to you about certain lifestyle choices that can keep you healthy. And today we talked about obesity and why it's important that everybody needs to manage their weight and also eat healthy and exercise regularly. Saturday is another day to exercise.
Okay.
At the stadium, if you're here in Oka, in some local governments in the state, it's already ongoing every Saturday. So that is what we do, 7 a.m. to 9 a.m. 2 hours of great exercise that can keep you fit and prevent all this obesity-ish. And also, we've been able to debunk the notion that you don't necessarily need to be very big for physically, for you to know that you're obese. Get that. So it's important that you check your BMI once to know where you are and, work on yourself so you could leave that threshold. Am I right?
Yes.
Okay. All right. So we'd like to thank Dr. Justina N. Okoli, registered nutritionist, dietitian, registered nurse educator, and of course the acting head of the department, Human Nutrition and Dietetics, Nnamdi Azikiwe University, Nnewi campus. Thank you, Ma, for coming on the Yes of the Living Show.
Thank you.
Okay, well, you've heard it. Please, regular exercise, eat healthy, stay healthy, because a healthy man is a happy man. All right, till next time on the Yes Healthy Living Show, I am Priska Wankor. Next week Friday, we'll be here again.